I like the music you are playing on the background.
Oh, thank you very much. I'll bring it back when I finish the interview. It means you're inclined towards the Rastafari movement in a certain sense, right?
Absolutely. I mean, it's one of my best genre of music.
Oh, fantastic. So your association is threatening fire and brimstone. Has it become an association that is always, on the warpath, or there's some proper motivation for this recent call?
All right. Thank you very much for this brilliant question. And let me take this opportunity to once again greet your cherished listeners. I keep saying I started listening to Radio Good as far back as in the mid 90s and then late 90s.
Ish. So you're an ardent fan.
Absolutely. I mean, when Kwame Sitaka and Co were there before they left. So, to answer your question specifically, Ghana Registered Nurses and Midwives Association is a very responsible association established in 1960. We've gone through a lot of challenges. We've come very far. We've served various governments. Our overarching interest is to seek to the welfare of nurses and midwives in Ghana and to enhance standards of nursing and midwifery practice in Ghana. Now, we are a political organization, and therefore, our actions and inactions are geared towards our core mandate. We have a challenge currently where a gentleman and some tax decided to visit Mayhem, besiege a public hospital, intimidated and beat up health workers. And how can we spit fire and brimstone? This is a profession that ought to be respected. The professionals therein are well certificated and therefore must be helped to provide that essential services that they've been trained to offer. Anything that attempts to derail or prevent them from going about their normal duties must not be tolerated. And every Ghanaian, well-meaning Ghanaian, the emphasis is well-meaning Ghanaian, must condemn this despicable act. My brother, it can be your sister, it can be your brother, it can be your daughter. Oftentimes, when it is not you, you don't feel it. But unless it comes very close to you. So we are not an irresponsible association. Nobody can dictate to us what to do and what not to do. It's not that when people are trying to align us with certain political organizations, I laugh because people don't know us that well.
Fair enough.
We have remained apolitical since 1960. That is why we are still relevant.
Fair enough.
So
without meaning to condone violence or unruly behavior, there have been times where people go to hospital. In fact, yesterday we carried out an interview with somebody who had gotten involved in an accident. And a boboya loaded with iron rods had collapsed on him. He found himself in hospital. And for 3 hours, the nurse on duty was sitting down. This is live. We spoke to him live. So the suggestion is that maybe the incident that happened at Ridge Hospital is a spillover. It's built on years of pent-up anger from all kinds of people alleging more treatment or more practice or, a complete lack of professionalism in hospitals on the part of some of our nurses. How should we handle this going forward? What is the association going to do? Or if, for example, I bring my patient to the hospital, and as a result of, this type of thing, like this Aboboya incident, if the person had died, what recourse do the family members of that person have? As far as your association is concerned, what should they have done?
Okay. So let me explain to you. I'll be the last person to attempt to defend indefensible and irresponsible behavior on a part of a professional who has been certificated to provide such essential service to the good people of Ghana. But we need to interrogate the issues. And I'm going to take my time to explain to you what happens in an emergency situation, especially in an emergency department or unit. Now, we need to get people to appreciate the nuances of what goes on there. It's not just like going to line up at OPD. But in the case in reference, as you mentioned, was there only one nurse on duty? Were they not doctors? Why are we always targeting nurses?
Because they are the first line of contact. They are the first line of contact.
I'm coming. As you have described, how can a hospital have one nurse sitting at an emergency department without a doctor or without any other senior nurse or colleague? And an accident case will be rushed, and that nurse will sit down unconcerned. I'm saying that this is not normal. If that happened, then that nurse will have to have his or her head examined. But I know professional nurses and professional nursing practice.
Doc.
That is not the code.
Doc.
No, let me explain.
Doc, hold on. Doc, hold on. Listen, between me and you, there are times you walk into a hospital and they're on their phones, putting up all kinds of attitude. It is a fact.
I'm coming there. Take your time.
Okay.
I will explain to you.
Fair enough.
Good. I'm saying that, yes, I recognize that kind of thing. It is possible that some of our members may misconduct themselves one way or the other. And we are taking steps of our association. In fact, we have even started. We are rolling out webinars trying to educate nurses and midwives about professionalism, evidence-based practice. Just last week, I organized one webinar for nurses and midwives. I got people from Canada, two people from one guy from Canada, one guy from the United States,
90.5,
and then an evidence-based expert as you have to take nurses and midwives through some of these things. We have recognized that, yes, there are some bad nuts amongst us. But that is not a justification for anybody to arrogate to himself any sort of power to lay a hand on a nurse or a midwife. You have no right to do that. Now, let me explain to you that when you visit an emergency department, there are systems, there are protocols, there are practices. Some of these things may not be known to you, and I'm sure that is what led to the incident that happened at Rich Hospital. When you go there, we assign people to color coding based on the agency, their mobility, and their eminent mortality. How critical your condition is, you'll be assigned to a specific color coding. When you are stable, after thorough assessment by nurses and doctors, they can assign you to green. They can assign somebody to yellow. They can assign somebody to orange, another to red. Oftentimes, you may have red, black or blue, but that one means that you have visited our ancestors, so you were brought in dead. But we end up at red. My brother, these are systems and procedures. And when you take the lead to the emergency department. Unlike OPD, which is first come, first served basis, irrespective of how you feel, if in the professional judgment of the doctors and the nurses, they think that somebody else's condition is more severe than you, they will take care of that person first. They will not leave you. They will give you some first aid because they have assessed you thoroughly and they know that you can wait while they attend to other people. It's not like they will go and be on their phones. If you have visited Rich Hospital emergency department, you will not even have that wherewithal to go and sit down and what that. You may have that situation in a ward where perhaps they have finished working, and sometimes you may be a visitor. You go into a ward, maybe they have finished doing whatever they are supposed to do. You see, there are nursing services that we render. If I finish what I'm doing, and perhaps I'm at my table, and I'm supposed to maybe even call. Sometimes you may think that somebody is on a call or something. He may be calling a senior colleague. I'm not trying to justify anything, but I just want you to appreciate the work that we do, because I cannot come to your studio and tell your cameraman how he should point the camera at you, because I've not learned videography. Why should people think that they know better than the doctors and the nurses, and therefore they can go and dictate to them how things ought to be done? I found that very, very repulsive and unacceptable. And you cannot do this anywhere. Yes, I admit that some of our members can misbehave, and I'm saying that we are taking remedial steps to correct those kind of misconduct, which is unacceptable, and I agree with you. But I'm saying that be that may, nobody has every right to assault any nurse on that grounds. Who says that we can do that in this country and get away with it and have the effrontery? Look, you go block a place, preventing other people from seeking health care 8-9 months ago, and by that process, somebody loses his child. And you think that for you are God sent. And therefore, when you come and you have been Triage Green, as he was at Triage Green, the way I've explained it, he says we should leave everybody and attend to him because he's more human than anybody. Look, this country belongs to all of us. It doesn't belong to a section of the needs. Look, listen to how I spoke about Mahama Care. When His Excellency, our President, launched that thing, our association gave the biggest donation among all the professional associations in Ghana. So we are here to support every administration so that they can actualize their vision. But we will not do so at the detriment of nurses and midwives in Ghana. And some of us did not stay abroad. And I've been reading on social media of my brothers in the NDC and other insulting, Ghana, if Ghana is not good, go. I'm not going anywhere. Some of us decide to return to Ghana because we want to protect nurses and midwives and protect the nursing and midwifery profession and to protect the good people of Ghana who come to our hospital to seek health care. They need our respect. And that's why I'm telling you that I've taken it upon myself based on the mandate that have been assigned by the president of the association to find every innovative ways to re-educate, upskill and reskill some of our nurses in terms of professionalism so that they can conduct themselves very well. So that even patients and their relatives and the lives of youth can become chief advocates for nurses and midwives, so that we will not even have to talk. Do you know the myriad of challenges that we go through on a daily basis to even give you that health care that some of you don't respect? And the ordinary Ghanaian think that he can lay a hand on a nurse and get away with it. I'm saying that nonsense will stop.
Okay, I think you should be temperate with the language, please. It's a bit early in the morning, and I'm sure some kids are listening with their parents as they drive along. So you be kind enough to refrain from using the N-word in this deliberation as much as possible. But, so, just briefly, in a few seconds, short seconds, what is the solution to this problem? What going forward, both sides, patients, medical professionals, what should we do to ensure that this never happens again? And number two, is the association willing to consider rolling out a mass media campaign to educate both sides of the divide so that going forward this will not happen again?
Thank you very much. And this is brilliant. I mean, you are such an intelligent journalist.
Oh, boss.
Now,
that is to suggest that some journalists are not intelligent too.
Absolutely. Like how some people think that some nurses are disrespectful and they are unprofessional and all that. There are bad nuts everywhere.
Okay.
Proceed.
Proceed.
Take the compliment and let's move forward.
Proceed.
What I'm saying is this. Number one, we need to arrest the perpetrators of these heinous crimes. They must face the full rigors of the law. We as an association will take every step to educate our nurses and midwives, and for that matter, other healthcare workers, to be professional and to respect and treat the Ghanaian health seeker with respect and dignity. It's something that we don't have to compromise. It's unfortunate you never came under my care. You would have loved it when I was actively practicing as an anesthetist.
Ish.
Okay. Again, we will have to be very intentional, and as you have rightly suggested, of educating the populace, the Ghanaian populace, about the nuances of what happens in an emergency situation, so that they can work in closer collaboration with us to move this country forward and to move the health sector forward. I will stand against any nurse or any midwife and make sure that that person faces any disciplinary action, either by the regulator or by ourselves as an association, if that person dare misconduct him or herself unprofessionally. And we are very mindful about that, and we are going to do this. Because, my brother, it is so lovely if you are a nurse and you treat a patient well. Sometimes it's not even the medication that you give. The way you speak to the person, the way you even receive the person, the way you bid the person off alone is enough. Because most of the patients that come, they may have certain pathological conditions, but they may also have certain psychological underpinnings. And once you are even able to even resolve those psychological issues, the pathology can even go, okay, with the slightest medication or whatever. So we need to respect our patients, we need to respect our clients, and treat them with a lot of, a modicum of respect. That is number one. Number two, the public must also know that we are the same people. The nurses are not angels drawn from heaven. They are your brothers and sisters whom you were brought up by your own parents in your own homes. They have just received a certain structured course of study that has prepared them as responsible citizens of Ghana and are there to offer such services, essential services. Let us improve internal security in our hospitals so that hooligans cannot decide to just enter a hospital, seeing people compromise their privacy. I'm talking about other patients, and get away with it. I think when we do that, we can move forward. And then, overall, have a proper health financing model. Look, I've been to other places. I'm saying that if we're able to fix our health financing model to the extent that people don't need to pay all money out of the pocket in times of emergency or whatever, Ghana will be one of the best destinations for healthcare. Why? Because you see, our culture is built in such a way that we are easily approachable and easily reachable. As you said, if you have any challenge, you can easily call me or call any doctor or friend of yours or any nurse. And the person responds. You can't do that in other jurisdictions. So I'm saying that if we're able to help, like we're able to support His Excellency the President, get this Mahama Care well structured, look at for other areas of financing. I suggested, and my association, agrees, that if we can even look at the proceeds from gold and assign a certain percentage, because all these galamsey that is going on, which we can't stop, are having detrimental effects on patient health in terms of kidney failures and stuff like that. So we can take some of the money there, put it in this Mahama care, so that people can, have health care. In primary health care, educating people so that they can, even stop this type of galamsey. Because if they know the health implications of the actions, they will stop it instead of even this, bow and arrow behavior that is not even resolving the matter. So I agree perfectly with you. Under no circumstance must a nurse or a midwife disrespect any patient. But that does not also guarantee anybody the audacity to go and visit mayhem on nurses and midwives who are professionally taking care of other patients. Because what the gentleman did compromised the healthcare delivery of other patients, not only himself and even the healthcare workers over there. So let us come together and condemn it. If it's bad, it's bad, irrespective of the political inclinations. And I don't know why this country is becoming so toxic about politics and we want to politicize everything. Once you say something and it's not in good taste or it doesn't fall in line with the thinking of your brother, he thinks that you are the other side and that for you are an enemy. Why do we do this to ourselves? So, bruh, if you called me this morning, this is what I have to say about this issue. But let us apprehend the young man. He is not about the laws of Ghana.
Finally.
If I fall foul of the law, I should be dealt with like any other.
Finally, have you had the opportunity to review the CCTV footage on the side of Ridge Hospital from the incident?
Yes, please. We have done that. And not only the CCTV footage, there are other cameras, including what Ralph and his people filmed, and he dropped on social media. Now, if you look at the conduct, the kind of everybody, I'm even surprised the nurses were there or the doctors were there, because people have to run away for their lives because they need to be safe to save others. Okay, one thing I must also let the public know is that the nurses and midwives and healthcare workers need to be safe to save others because they don't go to hospital with ammunition. And we shouldn't get there because if the state cannot protect us, then we need to find a way to protect ourselves. We shouldn't get there. We shouldn't look over our shoulders whilst we are rendering an essential services to our patients because somebody may come behind you and do something to you. No, we shouldn't entertain those kind of things. So irrespective, if Rap was my younger brother, I would have made sure he's locked by now. He will not be on social media having the effrontery and talking and defending himself.
Okay, fair enough. Now I think that you're being a bit judgmental. Let the law take its course. Let the appropriate hold on. Let the appropriate authorities take the action. Okay. First of all, there's a committee in place to investigate this. Yes.
Let me come in here. Let me come in here on this committee.
Okay.
If you permit me, respectfully.
Okay.
Is the committee BNI or CID? Let me tell you something. When incident happen of this nature, you don't put the cart before the horse. Yes, I agree perfectly with the minister to establish a committee. This is to look at the comprehensive and address the issue.
90.5.
Okay, it is comprehensively going to address the issues. But
so why don't you give it the opportunity
of the perpetrators? The perpetrators must be arrested so that they can go through due process. Whilst we put together the committee to look at the happenings so that we can bring corrective measures. That is medium to long term. Is the committee going to invite anybody and to say that why did you go there to beat a nurse?
But I'm sure the police would have a lot of gravitas on the matter and would know if there's enough to go on by way of making an arrest, right?
My brother.
No, Doc, hold on. Ghana fire there. I mean, again, if you're saying that we can't just invade a hospital and tell doctors and nurses how to do the job.
Not tell, beat.
Oh, I'm sorry? Beat.
I'm saying that we cannot go to a hospital and beat any nurse and get away with it.
Okay.
To be arrested.
As it is,
I cannot come to your studio and beat you up.
Hold on. As it is the word of the people in Ridge Hospital against the word of Ralph. Because we spoke to Ralph yesterday, And he was absolutely clear that no such assault went on. So at this point, we should just let the law take its course, let the necessary investigations be carried out, and then based on that, solutions will be proffered to whatever challenge it is. Right?
The lady has a dislocation. So she fell herself and dislocated her shoulder.
No worries. So at this point, I think we should just leave it here. Let the committee do its work. Let the police do their investigation, and then let the law take its course. But thank you for speaking to us, sir. Thank you for obliging us your time. Have a lovely day, sir.
Same to you.
All right, so that was Dr. David Tenkorang-Twum, General Secretary, Ghana Registered Nurses and Midwives Association. 2.5